Are you ready to tackle the Nclex like a pro? Rock it today. We're diving deep into obstetrics and gynecology, one of the most tested and sometimes trickiest areas on the exam. From labor and delivery emergencies to postpartum care and high-risk pregnancy scenarios, I've got 50 carefully designed practice questions with detailed rationales and strategies that will sharpen your critical thinking and boost your confidence. Stick with me till the end, because the final questions will challenge you just like the real Nclex. Let's get started and make obstetrics/gynecology your strongest topic. Question 1. A nurse is assessing a pregnant client in her first trimester. Which finding would be considered a presumptive sign of pregnancy? A. Fetal heart tones heard by Doppler. B. Chadwick's sign. C. Amenorrhea. D. Positive urine pregnancy test. Answer: C. Amenorrhea. Rationale: presumptive signs are subjective, experienced only by the client, e.g., amenorrhea, fatigue, nausea. Chadwick's sign and positive pregnancy test are probable signs. Strategy: remember, presumptive equals felt, probable equals observed, positive equals diagnostic. Question 2. A client at 28 weeks gestation reports dizziness when lying flat. What is the best nursing action? A. Place client in Trendelenburg position. B. Turn client to left side. C. Elevate head with pillows. D. Encourage upright sitting. Answer: B. Turn client to left side. Rationale: supine hypotension occurs when the uterus compresses the vena cava. Left lateral position relieves pressure. Strategy: Nclex loves positioning left side is safest. Question 3. The nurse teaches a pregnant woman about iron supplements. Which instruction is correct? A. Take with milk. B. Take with orange juice. C. Take only on empty stomach. D. Avoid vitamin C. Answer: B. Take with orange juice. Rationale: vitamin C increases iron absorption. Milk and antacids reduce it. Strategy: citrus boosts iron. Remember this key fact. Question 4. At 36 weeks, a client presents with painless, bright red vaginal bleeding. The nurse suspects: A. Placenta previa. B. Abruptio placentae. C. Threatened abortion. D. Uterine rupture. Answer: A. Placenta previa. Rationale: placenta previa causes painless, bright red bleeding. Abruption is painful with rigid abdomen. Strategy: think, painful equals abruption, painless equals previa. Question 5. Which FHR pattern requires immediate intervention? A. Early decelerations. B. Variable decelerations. C. Accelerations. D. Late decelerations. Answer: D. Late decelerations. Rationale: late decelerations indicate uteroplacental insufficiency. Immediate action is needed. Strategy: use veal chop, variable equals cord, early equals head, accelerations equals OK, late equals placenta. Question 6. At 16 weeks, an amniocentesis is scheduled. The nurse explains it is mainly for A. Fetal lung maturity. B. Detecting chromosomal abnormalities. C. Measuring contractions. D. Identifying fetal position. Answer: B. Detecting chromosomal abnormalities. Rationale: early amniocentesis, 16 to 20 weeks, checks genetics. Later in pregnancy, it assesses lung maturity. Strategy: match timing with purpose. Question 7. A woman receiving magnesium sulfate for preeclampsia shows which sign of toxicity? A. Reflexes +2. B. Urine output 35 milliliters per hour. C. Respiratory rate 10 per minute. D. FHR 140 bpm. Answer: C. Respiratory rate 10 per minute. Rationale: magnesium toxicity signs, depressed reflexes, low urine output, RR less than 12. Strategy: always monitor RR, reflexes, urine output on MAG therapy. Question 8. A postpartum client has a boggy uterus and heavy bleeding. First action? A. Call provider. B. Administer oxytocin. C. Massage the fundus. D. Take vital signs. Answer: C. Massage the fundus. Rationale: uterine atony is the main cause of hemorrhage, fundal massage is the first step. Strategy: on Nclex do first, then call. Question 9. At 32 weeks, a client has severe abdominal pain and a rigid uterus. The nurse suspects: A. Placenta previa. B. Abruptio placentae. C. Preterm labor. D. Preeclampsia. Answer: B. Abruptio placentae. Rationale: abruption causes painful bleeding with rigid abdomen. Strategy: rigid plus painful equals abruption. Question 10. During delivery, shoulder dystocia occurs. First nursing intervention? A. Apply fundal pressure. B. Perform McRoberts maneuver. C. Call for cesarean. D. Administer tocolytics. Answer: B. Perform McRoberts maneuver. Rationale: McRoberts maneuver, thighs flex to abdomen, is the first action. Fundal pressure is dangerous. Strategy: always choose McRoberts plus suprapubic pressure first. Question 11. At 20 weeks, a client has fatigue, thirst, and frequent urination. What test is expected? A. Amniocentesis. B. Oral glucose tolerance test. C. Biophysical profile. D. Non-stress test. Answer: B. Oral glucose tolerance test. Rationale: these are signs of gestational diabetes. OGTT is done at 24 to 28 weeks. Strategy: no timing of OB tests. Question 12. Which finding in preeclampsia is most concerning? A. BP1 60-100. B. 3+ proteinuria. C. Platelets 90,000. D. Edema in legs. Answer: C. Platelets 90,000. Rationale: low platelets, less than 100,000, indicate HELLP syndrome, which is life-threatening. Strategy: always prioritize critical labs. Question 13. Membranes rupture, and FHR drops from 140 to 90. First action? A. Prepare for C-section. B. Insert Foley. C. Give oxygen. D. Check for prolapsed cord. Answer: D. Check for prolapsed cord. Rationale: sudden FHR drop after rupture suggests cord prolapse. Immediate check is required. Strategy: safety equals check first before interventions. Question 14. Client on oxytocin has contractions every 90 seconds. Best action? A. Continue oxytocin. B. Document findings. C. Stop oxytocin. D. Encourage ambulation. Answer: C. Stop oxytocin. Rationale: contractions less than 2 minutes apart equals tachysystole, which risks fetal distress. Strategy: when in doubt, stop the drug causing distress. Question 15. Why does a postpartum mother feel cramps during breastfeeding? A. Estrogen drop. B. Oxytocin release. C. Milk letdown reflex. D. Progesterone surge. Answer: B. Oxytocin release. Rationale: oxytocin stimulates uterine contractions to prevent hemorrhage. Strategy: oxytocin equals contractions plus letdown. Question 16. A newborn of a diabetic mother is at risk for A. Hypoglycemia. B. Hypercalcemia. C. Low birth weight. D. Dehydration. Answer: A. Hypoglycemia. Rationale: high maternal glucose fetal hyperinsulinemia neonatal hypoglycemia. Strategy: Think LGA plus low sugar. Question 17. Postpartum woman has a firm uterus but continuous bleeding. Cause? A. Uterine atony. B. Cervical laceration. C. Retained placenta. D. Hypovolemic shock. Answer: B. Cervical laceration. Rationale: firm uterus plus bleeding equals laceration, not atony. Strategy: assess uterus firmness to determine cause. Question 18. Which statement shows understanding of first trimester nutrition? A. I need 600 extra calories daily. B. I'll avoid folic acid. C. I need 400 extra calories daily. D. I need folic acid to prevent birth defects. Answer: D. I need folic acid to prevent birth defects. Rationale: folic acid prevents neural tube defects. Extra calories are needed only later. Strategy: always link folic acid with neural tube protection. Question 19. During labor, a client suddenly has chest pain, dyspnea, and cyanosis. Likely cause? A. Uterine rupture. B. Amniotic fluid embolism. C. Pulmonary embolism. D. Placental abruption. Answer: B. Amniotic fluid embolism. Rationale: sudden hypoxia and collapse during labor equals amniotic embolism. Strategy: sudden plus labor equals AFE. Question 20. Best contraceptive for breastfeeding women? A. Combined oral contraceptives. B. IUD immediately postpartum. C. Progestin-only pill. D. Vaginal ring. Answer: C. Progestin-only pill. Rationale: estrogen decreases milk, progestin-only is safe in lactation. Strategy: choose progestin-only in breastfeeding moms. Question 21. A nurse is monitoring a client in labor who has an epidural. Which finding requires immediate action? A. BP 8850 mmHg. B. FHR 140 bpm. C. Maternal shivering. D. Urinary retention. Answer: A. BP 8850 mmHg. Rationale: the most serious complication of epidural anesthesia is maternal hypotension, which decreases placental perfusion. Strategy: always prioritize vital signs over discomforts. Question 22. A client at 10 weeks reports severe unilateral lower abdominal pain with vaginal bleeding. The nurse suspects: A. Placenta previa. B. Ectopic pregnancy. C. Threatened abortion. D. Hydatidiform mole. Answer: B. Ectopic pregnancy. Rationale: unilateral pain plus bleeding early in pregnancy is typical of ectopic pregnancy. Strategy: location plus pain pattern equals ectopic clue. Question 23. A woman in labor is 8 centimeters dilated, screaming, and says, "I need to push." Which stage of labor is she in? A. First stage, latent. B. First stage, transition. C. Second stage. D. Third stage. Answer: B. First stage, transition. Rationale: transition phase, 8 to 10 centimeters, is intense, with urge to push, irritability, and contractions every 2 to 3 minutes. Strategy: no labor stages and behaviors. Question 24. The nurse notes a uterine fundus displaced to the right and above the umbilicus postpartum. What is the cause? A. Uterine atony. B. Bladder distension. C. Retained placenta. D. Hemorrhage. Answer: B. Bladder distension. Rationale: a full bladder pushes the uterus upward and to the side, preventing proper contraction. Strategy: think, fundus up/right equals full bladder. Question 25. A nurse cares for a client with severe hyperemesis gravidarum. The priority intervention is: A. Provide small frequent meals. B. Start 4 fluids with electrolytes. C. Encourage oral rehydration. D. Administer vitamin supplements. Answer: B. Start 4 fluids with electrolytes. Rationale: severe vomiting leads to dehydration and electrolyte imbalance. IV therapy is the priority. Strategy: prioritize fluid/electrolyte balance first. Question 26. A woman at 30 weeks reports headache, blurred vision, and epigastric pain. The nurse suspects: A. Gestational hypertension. B. Preeclampsia with severe features. C. Eclampsia. D. Placenta previa. Answer: B. Preeclampsia with severe features. Rationale: neurologic, headache, vision changes, plus epigastric pain suggest severe preeclampsia. Strategy: epigastric pain equals impending seizure. Question 27. During labor, the nurse notes variable decelerations. What is the priority intervention? A. Give oxygen. B. Change maternal position. C. Increase 4 fluids. D. Notify provider. Answer: B. Change maternal position. Rationale: variable decelerations indicate cord compression, repositioning relieves pressure. Strategy: for Nclex, reposition first for cord issues. Question 28. Which statement indicates correct understanding of Kegel exercises? A. I should do them only during pregnancy. B. They help strengthen pelvic floor muscles. C. They will make labor shorter. D. They prevent morning sickness. Answer: B. They help strengthen pelvic floor muscles. Rationale: Kegels strengthen muscles to prevent urinary incontinence and support postpartum recovery. Strategy: link Kegels equals pelvic muscle strength. Question 29. A client's water breaks at 2 cm dilation. The nurse's priority is to: A. Assess maternal blood pressure. B. Monitor uterine contractions. C. Check fetal heart rate. D. Start 4 fluids. Answer: C. Check fetal heart rate. Rationale: the greatest risk after ROM is cord prolapse. Checking FHR ensures fetal well-being. Strategy: ROM check baby first. Question 30. A newborn's APGAR score at 1 minute is 5. What is the best nursing action? A. Begin chest compressions. B. Provide gentle stimulation and oxygen. C. Notify provider immediately. D. Place infant under warmer only. Answer: B. Provide gentle stimulation and oxygen. Rationale: a score of 5 indicates moderate distress. Stimulate, suction, and give O2 as needed. Strategy: APGAR 7 equals resuscitate supportively first. Question 31. The nurse is caring for a woman in the 2nd stage of labor. The priority is to: A. Assess dilation. B. Encourage pushing with contractions. C. Provide ice chips. D. Massage the fundus. Answer: B. Encourage pushing with contractions. Rationale: the 2nd stage is from full dilation to delivery of baby. Active pushing is key. Strategy: match stage with priority nursing care. Question 32. A nurse teaches about RH incompatibility. Which statement indicates understanding? A. ROGAM is given to RH plus mothers. B. ROGAM is given at 28 weeks and after delivery. C. ROGAM is only given if baby is RH-. D. ROGAM is not needed for the first pregnancy. Answer: B. ROGAM is given at 28 weeks and after delivery. Rationale: RH mothers need ROGAM at 28 weeks and within 72 hours after delivery if the baby is RH+. Strategy: mother negative plus baby positive equals ROGAM. Question 33. A nurse is assessing lochia on day 2 postpartum. Which finding is expected? A. Lochia alba. B. Lochia rubra. C. Lochia serosa. D. No discharge. Answer, B. Lochia rubra. Rationale, first 3 days postpartum, lochia is red, rubra. Serosa equals 4 to 10 days, alba equals after 10 days. Strategy, remember, rubra serosa alba. Question 34. A nurse assesses a newborn with respiratory distress, nasal flaring, and retractions. The priority intervention is A. Warm the infant. B. Suction airway. C. Provide oxygen. D. Notify physician. Answer, C. Provide oxygen. Rationale, signs of respiratory distress require oxygen and monitoring. Strategy, airway plus oxygenation always first. Question 35. A nurse provides discharge teaching after cesarean section. Which statement shows understanding? A. I can drive in 3 days. B. I should avoid lifting heavy objects. C. I will resume sexual activity in 1 week. D. I don't need to worry about infection. Answer, B. I should avoid lifting heavy objects. Rationale, post-cesarean clients should avoid heavy lifting for 4 to 6 weeks to allow healing. Strategy, teach safety plus incision care. Question 36. The nurse notes foul-smelling lochia in a postpartum client. This indicates A. Normal finding. B. Endometritis. C. Mastitis. D. Subinvolution. Answer, B. Endometritis. Rationale, foul odor is a sign of uterine infection. Strategy, smelly lochia equals infection. Question 37. A nurse is caring for a client with polyhydramnios. The fetus is at increased risk for A. Neural tube defects. B. Pulmonary hypoplasia. C. Cord prolapse. D. Growth restriction. Answer, C. Cord prolapse. Rationale. Excess amniotic fluid increases risk of cord prolapse when membranes rupture. Strategy, too much fluid equals cord risk. Question 38. Which vaccine is contraindicated during pregnancy? A. Influenza, inactivated. B. DAP. C. MMR. D. Hepatitis B. Answer, C. MMR. Rationale, live vaccines, MMR, varicella, are contraindicated during pregnancy. Strategy, NCLEX rule, no live vaccines in pregnancy. Question 39. A nurse is caring for a postpartum woman with mastitis. The best instruction is A. Stop breastfeeding until infection clears. B. Continue breastfeeding from both breasts. C. Use formula until antibiotics are completed. D. Avoid touching the breast. Answer, B. Continue breastfeeding from both breasts. Rationale, breastfeeding should continue to prevent engorgement and promote healing. Strategy, mastitis equals keep breastfeeding plus antibiotics. Question 40. A nurse is teaching about danger signs in pregnancy. Which should the client report immediately? A. Mild leg cramps. B. Headache and blurred vision. C. Frequent urination. D. Breast tenderness. Answer, B. Headache and blurred vision. Rationale, these are signs of preeclampsia, which can be life-threatening. Strategy, always prioritize neuro changes plus vision changes. Question 41. Which intervention is most important after giving oxytocin postpartum? A. Encourage fluids. B. Monitor uterine tone. C. Promote ambulation. D. Record lochia amount only. Answer, B. Monitor uterine tone. Rationale, oxytocin strengthens uterine contractions to prevent hemorrhage, monitoring tone is crucial. Strategy, always monitor the effect of the drug. Question 42. A nurse is caring for a woman with preterm labor. Which medication is given to promote fetal lung maturity? A. Nifedipine. B. Terbutaline. C. Beta-methasone. D. Magnesium sulfate. Answer: C. Beta-methasone. Rationale: corticosteroids like beta-methasone accelerate fetal lung maturity. Strategy: steroids equals surfactant boost. Question 43. A nurse notes FHR accelerations on monitoring. What is the interpretation? A. Fetal hypoxia. B. Normal, reassuring sign. C. Cord compression. D. Placental insufficiency. Answer: B. Normal, reassuring sign. Rationale: accelerations indicate adequate oxygenation and fetal well-being. Strategy: accelerations equals always okay. Question 44. Which finding in a newborn should the nurse report immediately? A. Acrocyanosis. B. Jaundice within first 12 hours. C. Moro reflex. D. Irregular respirations. Answer: B. Jaundice within first 12 hours. Rationale: early jaundice is pathological and may indicate hemolysis. Strategy: physiologic jaundice equals after 24 hours, before equals abnormal. Question 45. Which fetal position is most favorable for vaginal birth? A. Occiput anterior. B. Occiput posterior. C. Breech. D. Transverse. Answer: A. Occiput anterior. Rationale: occiput anterior is the ideal position for delivery. Strategy: OA equals optimal anterior. Question 46. A nurse notes a postpartum woman is at risk for thrombophlebitis. Best preventive action? A. Strict bed rest. B. Early ambulation. C. Limit fluids. D. Apply abdominal binder. Answer: B. Early ambulation. Rationale: early movement promotes circulation and reduces clot risk. Strategy: movement prevents clots. Question 47. The nurse observes late decelerations. What is the priority action? A. Reposition to left side. B. Increase oxytocin. C. Check cervical dilation. D. Encourage pushing. Answer: A. Reposition to left side. Rationale: left lateral position improves placental perfusion. Strategy: late decels equals turn, O2, 4, stop pit. Question 48. Which condition is an absolute contraindication for vaginal birth after cesarean, VBAC? A. Prior low transverse incision. B. Twin pregnancy. C. Vertical uterine incision. D. History of gestational diabetes. Answer: C. Vertical uterine incision. Rationale: vertical/classical incisions risk uterine rupture. Strategy: low transverse equals safe, vertical equals no. Question 49. A nurse notes excessive swelling of hands/face in a pregnant client. What should the nurse do? A. Reassure as normal. B. Assess for preeclampsia signs. C. Increase fluid intake. D. Encourage more rest. Answer: B. Assess for preeclampsia signs. Rationale: sudden swelling can indicate preeclampsia and should be assessed promptly. Strategy: edema plus pregnancy equals suspect preeclampsia. Question 50. The nurse is teaching postpartum depression warning signs. Which should the client report? A. Crying when baby cries. B. Feeling sad occasionally. C. Thoughts of harming the baby. D. Fatigue after feeding. Answer: C. Thoughts of harming the baby. Rationale: this indicates postpartum psychosis, a psychiatric emergency. Strategy: always prioritize safety plus suicidal/homicidal ideation.